Hi everybody and welcome back to ABCD. I am your pediatric dentist, Dr. Kirthiga. So I had left you with a question or with an interesting subject last video. I had told you that the different stages of childhood decay, and I had told you that there is something special about the mild stage, right? Where I had shown you the white spot lesions. I had told you that I think there is something very special about it. That is what we are going to watch in today's video in ABCD. So you know what is the good news about the white spot lesions or the mild stage of childhood decay? The good news is that it doesn't need any treatment at all. Isn't that fantastic news for all you mothers, fathers, caretakers of children? Yes, but there is a small catch there. Now the small catch is that how will you identify that there are white spot lesions for your child? That is not going to be easy. For that, as a pediatric dentist, when you bring your child, him or her, to me, I have to dry the teeth with a piece of cotton and then I have to visualize. So remember, white spots on white teeth, it sounds very tough, right? Sounds difficult by itself. How can I diagnose white spots on white teeth? These white spots are going to be much more whiter than the teeth themselves. Therefore, because of the opacity and all those physics and the light properties, that's the reason I told you that you can only see it when it's dry. And imagine you drying a teeth of a 1-year-old or a 2-year-old, it's going to be very challenging. And it's best done at the dental office with the help of a pediatric dentist like me, and there are many like me out there. You can get it checked by anybody. So what is the bottom line? The bottom line is that the moment the first tooth erupts in your baby's mouth, it could be 6 months, it could be 10 months, it could be 12 months, rarest it could also be 14 months. The best thing to do is, as soon as you see the teeth pop out in your baby's mouth, please take him to a pediatric dentist. Like me, we are at Chennai, we are at Ananagar, but there are lots of pediatric dentists across India. Please take him or her to your closest pediatric dentist and they will be able to check if your child has white spot lesions. If your child has white spot lesions, it is good news, not because your child is diagnosed with the mild stage of childhood decay. It is good news because it is diagnosed at that particular stage where there has to be nothing much done. We can just apply a gel and we can just tell you how to maintain oral hygiene and the decay is going to be reversed. So that's the magical stage of childhood decay. It's not going to happen at any other stage. So take your child today to a pediatric dentist, whoever is closest to you, and get your child's oral cavity checked. So this is Kirthiga signing out, and my next video is going to tell you what happens if you're not going to treat childhood decay. Is there any consequence or is it fine? You say that, okay, they're just baby teeth. Now let's see that in my next video. Bye-bye.